Welcome to this session of counseling with the Councilor Jerome Yanam. We'll be discuss and find a solution for drug addiction with the client Roger Mainge. Good morning. Please take your seat. This is a counseling office. Usually we used to solve problems, people dealing with different kind of problems, relationship problems, marriage problems, or people, in schools and they face, or smart things they face problem. They usually come to this office so that we can deal with them. This office is a counseling office. Firstly, before we start, my name is Jerome Yanam. I'm from Southern Province. Usually they call it Isipik, Wesipik, but Wesipik we call Southern. So, yeah. Thank you for coming. This office operates 10 years ago, but I've been moved here around 3 to 4 years. I've been working here. Mostly the client are my customers or my people that I'm dealing with. I'm serving them is around 3 to 4,000 people that I'm dealing with their problems. But usually in 1 week, less than 7 to 10 roughly they usually come here to share their problems, and I'm usually advising them to do this, avoid the problems. So before we begin our session, what's your name and where are you from?
I'm more than happy to hear that you are from Sandan. I am from Isipik Province, from Dangor District. My given name is Roger, my surname is Mainge. I am doing my third year at the University of Florida this year. And I rented Kama from Red Corner, and you will go all the way towards Butte side.
Oh, from Osig and down.
Yes, that's the place that I usually reside there and travel up and from to school.
That's good. Okay, Roger.
Yeah.
Since you tell me that you are addicted with alcohol and betel nut, for how long did you addicted to these two drugs? Yeah, betel nut and alcohol. I know that's the most boys they addicted to these two drugs. So yeah, for how long?
Like for betel nut is almost 23 years now. My age is 27. Since I was from the time that I was born in 1997, back at my home in Isipik Province, betel nut is everywhere.
Yeah, I see.
So at that time, my grandmother lent me to chew betel nut, and from there I started chew till today. And especially for betel nut, I chew betel nut as much as I can, and I am really addicted with this.
Okay.
And for alcohol, whatever little money that my parents back at home, they send it for me to purchase my stationery and school stuff and all this, or sometimes my relatives, whatever little money that they give it to me, the first thing that pop out of my mind is straight, I always think about alcohol. So most of the money that I receive from
your parents
from my
parents
and relative, I spend to buy betel nut, alcohol and all this.
It's good that we both from Sibik.
Yes,
usually I'm dealing with people from different kind of provinces, but mainly Sibik people I don't see most of them coming here. But thank you for you coming.
Oh, seems like I am the first one.
Yeah,
right?
no, not first one. Maybe 4 to 5
Okay.
Thank you for coming. This is your office. Since we bought from Civic, please feel free to tell me what's your problem, what you worry. I mean, please feel free, open up.
Okay.
So, actually, what brings you here to this office?
I am addiction with alcohol and
Oh yeah,
but
nowadays,
then
boys, you guys are drinking and smoking, so that you are addicted to it. So
Yes.
you come here, right?
Yeah. For Peterlat, almost 23 years old now. My age is 27. I used to Peterlat since
You are 4 years old. Right?
since 4 years old.
Wow.
My grandmother led me to Peterlat and I chew there up till today. And when it comes to Peterlat, I used to chew Peterlat as much as I can. Because back at home, Peterlat is everywhere. It's kind of, it's a coastal place. So Peterlat growing everywhere.
Yeah.
And for alcohol, it's not really bad. Especially, as you'll understand, we boys, like, whatever little money that we have, as for me, whatever little money that my parents send from home or my relative, they feel for me and they give little money to buy my stationery and for bus fare. All this, most of the time I used to buy Peterlat and some I used to buy alcohol and I continue drinking alcohol up till today. And I've noticed that
since you're a student, how often do you chew Peterlat and drink alcohol?
For alcohol, especially in the weekend, sometimes after the exam, meeting break exam, or in some of the like social events like being watching some of the boys playing rugby or soccer, or after that when they want to drink alcohol, I usually get involved with them and socialize and drink alcohol together. But for Peterlat, it's every day, like from morning, even 10 o'clock, 12 o'clock, 3 o'clock, evening, up till until I sleep. Whenever I wake up from the bed, the first thing first, I go straight to Peterlat.
What actually triggers you to smoke? Not smoke, drink and chew Peterlat.
When I feel, in stress, and with my friend who drinks, with my friend who drink alcohol. Yes.
How does it makes you feel after using these two drugs, like chewing Peterlat and drinking alcohol?
Temporarily relief, but after consuming alcohol, like later I feel guilty and ashamed of what I did.
Have you noticed any health problem about these two drugs, chewing and drinking?
Health problems in my body, right?
Yeah.
Okay. Yes, I often have headaches and sometimes I feel weak. Most of the time, in my mouth, the lime usually damages my mouth. So sometimes I think that I will get mouth cancer.
Do you want to get some help to stop these two drugs, or do you want me to help you with some steps to cut down from using these two drugs?
Yes, I really want to change this addiction a bit. It become a bit in my daily life. As a young man, I think it's good that the earlier is better for me to quit these two drugs before anything can happen for the good of my health in my body. So you told me to give some of the guide to
Cut down.
Cut down or quit on these two drugs. I am more than happy. You can please. give me this advice in whatever little ways as you can.
That's good. We can work on some steps to help you reduce eventually or stop. Are you ready?
Yes, I am.
Great. We'll start with some small goals and support you every step of the way. Okay, Roger, to minimize or stop your addiction, here are a few things you can try. Step number 1, set some goals, small goals, sorry. Start by reducing how much you drink or chew every day. Step number 2, avoid triggers. Avoid triggers simply means stay away from situation or stay away from people that want you to use these drugs or alcohol or bitter nut. Step number 3, find alternatives. Find alternatives simply means do something healthier when you feel the urge, like walking or talking to someone. Step number 4, seek support. Talk to your family, friends, or your relatives, or your pastor, or church members, kind of. Step number 5, it's final but not the least, keep yourself away, like simply avoiding friends or just do your private work, busy. Keep yourself busy to avoid this to addiction, drugs, like playing soccer, involved with youths, playing games or watching movies. So, Roger, the final step is you have to be patient. Recovery takes times, and it's okay to have setbacks. What's important is to keep trying. With that, since you have been with me throughout this session, is my counseling helpful?
I really love the counseling session. It's like first of its kind. I've never been in counseling session before, but just today I'm coming to in the office. The way you welcome me into the office, I'm sitting down here, listening to you in whatever like the points that you just gave me to follow, and I believe that the six points that you give. The number 1 point you told me to avoid triggers. Number 2 is to find alternatives. Thirdly, seek support. Fourthly, stay busy. And finally, to be patient. I think that those steps will help me to quit alcohol and chewing of bitter nut. If I notice that I still continue, I will come back for further advice from you, or whatever little steps that you will advise me to carry on for the next step.
I am more than happy to hear that. Remember, Roger,
Yes.
you don't have to do this alone. Every small steps counts towards the healthier life. With that, Roger, I think we are coming towards the end of our session.
Thank you so much. I really appreciate the counseling session with you.
Please feel free if you want more advice or if anything, please feel free to come. This is your office and I always be here. Thank you.